Hello, this is Carl Wojnar. I have a few interests in physical therapy. The first one being geriatrics, second being veterans, and then the third is working with Medicaid and Medicare patients. When talking about my flexibility, I have experience I lean on from ClinEd 1. I had a older patient, very sweet lady, who would often forget. I'd say about 50% of the time she would forget when her appointment was, the specific time. It would just show up at any other time during the day. So when this happened, the first time threw me off a bit, but what I found worked best was to lean on my aides and my assistants. So I would be working with a patient, she would come in, I would finish up whatever I was doing with that patient, then have an aide or an assistant finish that patient out, and then also rely on an aide or assistant to maybe set up the next patient as I worked with this older lady. A time that I accepted some constructive feedback was also during my CE1 experience. During the first couple days, I was very excited, very interested in applying all the knowledge that I had to the clinic. So what I would do when my CI was with a patient is I was kind of talk out loud. I would say, oh, I think you're doing this because of this reason. Is this correct? Just trying to get some feedback to see if what I was thinking of was actually the correct thought process that I should be having. However, my CI did not like this. He sat me down and said that if I continue this thinking out loud practice, then all the patients are going to see me as a student, as somebody who doesn't really know what they're doing, and it's going to ruin that relationship with the patient. And this made a lot of sense to me. However, I still wanted to ask questions. I still in some cases I needed to learn. So what we did is at the end of every day, we'd take 10 minutes and I could ask any question I want as much as I wanted. But during those face-to-face patient encounters, I would keep my mouth shut, just answer their questions. So in preparing for my clinical experiences, I look at it in kind of two buckets. There's your soft skills and your hard skills. So for soft skills, I read a lot of books. I read books on body language and how best to influence people to get them to see things from your point of perspective and to see things from their point of perspective. And then I kind of test this by putting myself in very difficult social situations within a huge range of people. And in addition to this, I also chose to be on our interprofessional healthcare research team, where we look at the different professions in healthcare and how they interact with each other and how to kind of smooth and streamline those interactions. For my hard skills, I plan to take our dry needling elective before I graduate school so I can get that certification out of the way. And then my goals for after graduation. So first goal is probably to just build up that confidence. I plan on doing this through repetitions and by reading the literature. So if by repetitions I know what I'm doing is working because I see that it helps my patients, and then I can also back up what I'm doing with the literature, that will give me the confidence to go forward and really take over the role of the physical therapist. The way I plan to measure this is by my ability to handle full caseload in the first 3 months of my practice. My second goal is to be clinical Spanish certified within the first 3 years of my practice. And then my third goal is to develop a strong relationship with my mentor and become a mentor myself within the first 5 years of my practice. Thank you for taking the time.